Do your hips snap or click when you raise your leg up just like that? You might have a condition called external snapping hip syndrome. Keep watching this video to learn more. External snapping hip syndrome is a condition that affects the muscles of the outer hip. It could cause an audible, painful, or sometimes non-painful click or snap sensation found along the front of the hip and towards the side of the hip. This condition is often related to the tendons and muscles of the gluteus minimus and gluteus medius muscles. These are your hip abductor muscles, and it could occur in those who are deconditioned or in those who are increasing their exercise volume or frequency way too quickly. The clicking or snapping that you feel during these movements are often related to a very tight muscle or tendon clicking over a bony surface found on your outer hip. For this condition, it can sometimes take anywhere between 6 to 8 months for it to recover, and in very severe circumstances, it might not go away completely, but at least the pain can be diminished to the point where it doesn't bother you at all. Since the problem at the end of the day tends to be really tight muscles, what we want to do for your exercise program is improve soft tissue flexibility, we want to improve joint mobility, and then eventually end range strengthening. So we'll be going over all three of these during different phases of this rehab program. So first, we're going to start with phase 1. That emphasizes soft tissue flexibility. Let's get started. All right, so the first exercise we're going to be doing is an elevated incline pigeon stretch, okay? So for that, we do need an incline bench, or you could set this up on a couch with a bunch of pillows to support your thigh. So for now, I'm gonna be setting up this bench at about a 30 to 45 degree angle. And what I'm gonna do is just place my target thigh onto that bench. So I'm targeting my left for the purpose of this exercise video. I'm going to rest my shin completely against this bench, and I'm going to support my upper body with my hands if I need to, or I'm just going to put my full weight into it. My back leg is going to lunge backwards. So I'm going to try to get this far back as I can, and then I'm going to let my hips sink down below the level of the bench. From here, I'll feel those glute muscles stretch out. If I need to, I could always lean forward to deepen that stretch going through my hip abductors. I'm gonna hold the stretch from anywhere between 20 to 30 seconds, and I'm gonna be doing about 2 to 3 sets a day. Now for stretching, you have to do it daily, otherwise you won't get the flexibility gains that you need to get. You could split up those 3 repetitions throughout the day. You could do morning, afternoon, night, or you could do it all at once. Just make sure that you're giving yourself at least 1 minute of rest between each repetition. If you can manage, you could decrease the incline of the bench. Eventually you want to be able to just do it from a flat surface, because that will lead to a deeper stretch going through those hip abductor muscles, and you're just going to let your body sink down into that. Next, we're going to be targeting some of your other hip abductor muscles using a pull-up assist band. For this next exercise, we're going to be using a green pull-up assist band to pull our leg into adduction, adduction. And so this is so we could target the gluteus medius muscles and the gluteus minimus muscles a little bit more effectively. So what I'm going to do is I'm going to make sure I anchor this band to a surface that's a bit above my head height while I'm sitting on the floor. Again, be sure to use a padded surface to support your back. And I'm going to just loop the other end around the back of my heel and ankle. I'm going to shift my body away from the band's anchor point, and that's so that I could get the band to pull on my foot. From here, just lying down, I'm just going to let this band pull me into a stretch, and I'm going to hold that for about 30 to 60 seconds. Now, if you don't have a band, I can show you another version of this exercise that you could do. All you have to do is lie down on your side, target hip on the downside. From here, keep that thigh flush with the floor, and then you're just going to raise your torso up to feel a bit of a stretch into your hip abductors. Now, to be quite honest, you're not going to get the same type of stretch doing this version of the exercise as you would in the banded version. So if you can manage to purchase one of these bands, if you don't have one already, some commercial gyms have the band readily available. Maybe you could borrow one from them and just let your body sink into the stretch. Just like our previous exercise, you'll be holding the stretch for 20 to 30 seconds, making sure that you rest for at least 60 seconds before you try out the stretch again. So moving on to our phase 2 exercises, we're going to do a PNF version of this exercise that we just did. PNF stands for proprioceptive neuromuscular facilitation. It's a type of stretch that gets you to engage your muscles while you're in your lengthened or elongated positions. So luckily enough, the setup is very similar, pretty much the exact same as what we just completed. I'm going to take that same band and I'm going to loop it again around my target hip's ankle. The only difference is that we'll be alternating between cycles of contraction and relaxation. So first thing I'm going to do is lie down and get the hip to just relax. And I'll be holding that relaxed position for about 5 to 7 seconds. After about 5 to 7 seconds, I'm going to drive my heel outwards towards you, the audience, the camera. So just to kind of visualize it, I'm driving my ankle this way, but I'm going to be making sure that I'm actually not moving. So I'm just meeting the band's resistance here. So I'm going to drive out now. And now I'm going to feel the contraction of these hip abductor muscles. I'm going to hold that contraction, and it's a light to medium contraction for about 5 to 7 seconds, and I'm going to let go. And when I let go, I should notice that that same angle that I just worked on feels a lot easier to hold. So I'm going to deepen the stretch by just shifting my body away from the anchor point again. Now I feel a light stretch again, and then I'm going to rinse and repeat. Do this for anywhere between 5 to 7 repetitions. Once again, similar to your regular stretching activities, you'll be doing PNF stretches daily as well. Moving on to our second exercise for our phase 2 program, we're going to be doing a straight leg fire hydrant exercise. This is a modification of your standard fire hydrant, but the extended leg position does help with the activity of gaining and recruiting the hip abductor muscles. So starting on your hands and knees on a padded surface like a yoga mat or exercise mat, I'm actually going to start with my leg stretched out for the targeted hips. I'm targeting this hip here. From here, all I'm going to do is raise this leg off the ground as much as I can without rotating through the torso, okay? So I don't want my pelvis rotating. I don't want my torso rotating, because then you're not really isolating the movement to the correct muscle group. From here, maintain a nice, as stable position as possible. I'm going to try to lift that leg up, feeling those hip abductor muscles activate. And I'm going to bring it back down. You're only going to go for a 2 to 4 second contraction. Some of you, since you might be deconditioned or not used to this movement, it might feel like a cramping sensation. If it feels like it's going to cramp out, just go back and do a few more reps of the elevated incline pigeon stretches. That should help calm things down, and then try to get back into the activation exercise that we're doing right now. So once again, keeping my tabletop position stable as much as possible, just going to raise that leg up. And as you can tell from my strained voice, it's quite hard to do. And then I'm going to lower it again. For this exercise, you'll be aiming anywhere between 8 to 15 repetitions if you can manage. But if you can't hit that rep range, that's a-okay. That's just where you are today. If you can only do about 4 repetitions, even less than that, that's your starting point. Just rest up for a minute before you do your next set. We're going to be aiming to do anywhere between 2 to 3 sets. And we're going to be doing this exercise about 3 times a week. Because this is a higher intensity exercise, we want to make sure that we're giving our tissues a 1-day recovery period in between exercise sessions. So let's move on to our strength and conditioning phase 3, which we'll be doing in and around about week 4 to week 6. The first strengthening exercise that we'll be doing during our phase 3 rehab is hip airplane exercise. We are going to be using a wall though for a bit of balance, and we're going to be modifying it so that we can get a really deep stretch as we want to work every single range that we're dealing with. So first thing I'm going to do is stand on the targeted leg, and I'm going to raise the other one off the floor because I just want to make this a single leg exercise. From here, you can bend your knees if you need to make it a little bit comfortable, and I'm just going to be keeping my back as neutral as possible. A little bit of curvature is a-okay, as that won't really do much to negatively affect this exercise. So I'm going to place my hands on the wall, and I'm going to just use that for balance. First thing I'm going to do is twist inwards so that my chest is kind of feeding through underneath my arm here, so that I can feel a really deep stretch going through my hip abductor muscles. From here, I'm going to activate these hip muscles by rotating and contracting these muscles here so that my chest is now facing the opposite direction. And I'm going to use my hip abductor muscles to squeeze and contract, and it's really important that I'm using this wall as little as possible, as the increased amount or increased demand of balance will increase the engagement of these muscles. So as I'm coming back down, I'm going to go back into a stretch position, and once again do repetitions of this, really going for a maximum hip abductor contraction. For this strengthening exercise, we are going to aim for anywhere between 8 to 12 repetitions, about 2 to 3 sets, making sure you're resting at least 90 to 120 seconds or 1.5 to 2 minutes between sets. And this is so that you could keep each set very high quality, get the good amount of reps in at a good intensity as well. Because it's a strengthening exercise, we'll be doing this about 2 to 3 times a week, making sure that we're resting the muscles every other day. Next, we're going to go into our second strengthening exercise for this condition. The next exercise that we'll be doing is a banded tactical frog exercise. For it, you're going to need a loop band. You're also going to need a well-padded surface like an exercise mat. If all you got is a yoga mat at home, what you can do is just fold up a few towels and use that as an extra cushion for your knees, just so you have an extra padded surface. Let's get started. So first thing you're going to do is place that band around your knees, And you're going to go in what we call the quadruped position, except for what we're going to make sure you're doing is that you're straightening those knees as far as you can, just so we could get into end range abduction here. From here, you can support yourself from your hands or down your elbows, whichever is easiest for you. And you're going to just rotate your leg so that it pulls that band away from the other leg. You're going to feel that contraction in these hip muscles, and then you're going to come back down. You can hold that contraction for up to 4 seconds. Really depends on what you can tolerate, but right now I'm feeling those hip muscles activate like crazy. And then I'm going to come back down and rest. For this exercise, you're going to be aiming for anywhere between 8 to 12 repetitions. You're going to be doing about 2 to 3 sets, making sure you're resting for at least 1.5 minutes to 2 minutes between sets, just like that last exercise. You're also going to be making sure that you're doing this every other day. It's best to do this on the same day as the last strengthening exercise, so you can have a complete rest day on the days in between your exercise sessions. All right, so that wraps up our video on external snapping hip syndrome. If you have any questions, let me know in the comment section below. If you're still getting issues after trying out these exercises for a few months, it's really important that you see your healthcare practitioner to see what the heck is going on. This video does not replace an assessment. If you are wondering what's going on, always best to see a chiropractor or physiotherapist near you for a physical assessment. If you're in the GTA, you can of course check out the Rehab Hero clinics. We have one in Markham and one in North York. If you haven't had a chance yet, please hit subscribe and follow our channel. Every subscription helps so much to support us. Until then, I'll see y'all next time. Peace.